What? I lost everything. Hmm. Hmm.
Are we switched over?
Yes,
Yes.
we have switched over. We have about almost 100 attendees.
Okay. You ready to go? All right. Good evening and welcome to everyone in the Redwood Shores community. We're here to discuss the TownePlace Suites. Thank you for taking the time to attend tonight's meeting. My name is Sue Nix and I am the president of the Redwood Shores Community Association. RSCA would like our community to know that we are working diligently with the county on this new housing complex venture. This has been a rapidly developing program and RSCA has only recently been able to become involved, but we've been in communication with the city and county to discuss how this will work for our community and the new residents of Redwood Shores at the Town Suites. RSCA has been assured that this discussion will continue regarding who will operate the complex, and we will continue in the future working with the operator and new residents as we have with other complexes in Redwood Shores. Tonight's meeting is to answer questions the community has submitted. Any questions that are unable to be brought up this evening due to time constraints will be addressed on our website, rsca.org. Also, a recording of this meeting will also be available to be viewed afterwards on the RSCA website within the next few days. Again, thank you for attending the meeting. And at this time, I'm going to turn the meeting over to Mr. Jim Hyde, who will be our moderator for the evening.
Thanks, Sue. Welcome, everybody. It's kind of hard. I hear there's 100 people out there, but unfortunately, we can't see any of you, so it's very, very flat. I got to be trying to do this. But, one of the interesting things about this time that we're in is the use of technology to have these community meetings, which is great because we, I think, get a lot higher attendance and we have a record of the conversation in a much better way. So thanks to this Redwood City for providing the technology to support us. I'm new to this issue, but it's not uncommon. I focus my work on a lot of community and housing issues around the country. So these kinds of topics and these kinds of concerns are not uncommon to me. And I'm very familiar with both the anxieties and the fears and some of the solutions that are working. And so I was asked by one of your council members to facilitate the conversation with a little bit of not having a lot of a stake in this, but hopefully provide a little bit of impartial and distant observation. And while I've come to learn the difficulties of this project, I'm impressed that so many people and all of the major players that are here tonight have taken time to try and answer some of the questions that are of concern to the community. So thanks to everybody for coming. Thank you, Sue, for your work and your organization for putting this together and especially helping to curate the questions and organize them. And thanks to Redwood City and San Mateo County for participating and being able to be part of this conversation. So before we get started, I wanted to take a few minutes just to talk about how tonight is going to go, because I know there's obviously a lot of questions. There's a lot of work before this. And so we want to try and organize this as efficiently as possible. We have 90 minutes, and one of my jobs is to make sure we get through all of the stuff and finish on time. We, as I said, have a great group of questions that have been submitted, and our CSA has done a great job of compiling those, and more than just compiling them and collecting them, but organizing them. So we've got a very good kind of way to follow this in a logical order. So what we're going to do tonight is we're going to open with just a framing of the conversation by Mike Kalegi of San Mateo to hopefully provide a baseline understanding of what this project is. Because the little bit that I've been involved just reading through some of the questions, I think there is some confusion or lack of clarity about what the project is. So I think to have a meaningful conversation, it's important for us all to start on the same page as to what exactly is being proposed. And then talk a little bit about why it came to be, why it's important to the community, and frankly, why the timeline was so short. As Mike explained it to me, there's some very difficult things that were the realities that we face in this day and age, and it had to be done the way it was done in order to take advantage of some opportunities that were fairly unique in the state. After Mike spends about 10 minutes to set the stage and at least provide that baseline, we'll go into a kind of a moderated conversation that is a direct response to the community's questions. And we've organized those into three topical areas: tenant selection and management, community and resident health and safety, and day-to-day operations. And then we'll close out with a section, again, probably just Mike sharing with us, where do we go from here? What's the process? What's the next steps? Obviously, a lot of the concerns will be addressed by hiring the right operator. So how does that get done? And we'll be talking about that. There's a couple of I wanted to manage expectations a little bit, because these things are very difficult, both because of the remote nature and because of the anxiety around this project. I know there's a lot of concern and frustration on the topic, but it's important for everyone that's listening tonight to understand that many of the details are still being worked out. So in a perfect deep world, these details would have been solved before, but the nature, again, of where we are in this process and the nature of the opportunity that's been given to the county, that just was not possible. So please listen for where we've got answers, and where we don't have answers. Sue and I talked about this yesterday. We're just going to put these things in a parking lot. And that's a shorthand that we use in community meetings. But until we know more information, we'll acknowledge what we can and say, okay, we're going to put that in the parking lot. But it's important for you to know that just by having raised the issue as the community, it elevates it as part of the program of work going forward. So just because we can't answer it doesn't mean people don't care or that it's not important. It is. It just frankly can't be answered at this point in time. So with that, I'm going to turn it over to Mike to kind of get us started with this, how we got here, and more background on what is being proposed.
Thanks, Jim. And Sue, I really appreciate the opportunity to have this communication with the residents of Redwood Shores as the county manager. And I'll ask Redwood City to start to put those slides up for me. But as I do that, I just want to acknowledge that we have some members of the county on this conversation listening in, and certainly the president of the Board of Supervisors, Supervisor Slocum, is on, along with, I believe, all the other board members from the county. So I'm glad they're with us. I also have Deputy County Manager Peggy Jensen, and our Director of Housing, Ray Hodges, and the Director of Human Services, Ken Cole, and I believe Dan Belleville, who is the new Office of Emergency Services Manager, on also. So before we get into the slides, I just want to take a moment, and I believe we also have our Chief of Health, Louise Rogers. I just saw her there too. So that's great. Before we get into the slides, I just wanted to take this opportunity to say I understand that a lot of people are upset because they were caught off guard by this, that this evolved very quickly and has caused a lot of anxiety. I believe that information is power, and to the extent that you didn't have the information as a community to really be involved in this process, I take full responsibility for that. As the county manager, that's my job, to make sure that we involve communities in this discussion. The buck stops with me. As Jim indicated, there are some unusual circumstances here, but I will work, this is a promise, I will work to regain the trust of the community as the county manager, because everything we do, we want to do in collaboration, especially with our communities, especially with our cities. And I think we've gone a long ways to doing that. My goal is tonight is to really try to answer as many questions as possible so that the community can have the information they need to feel fully informed and to really understand what's going on here. So we can go to the next slide. So one of the questions was, why was the Redwood Shores community not previously involved in this proposal? And I thought the best way to kind of illustrate this was through a timeline. And you can see that the first round of Homekey awards was really in September, September 16th, many months ago. And we had put in for one place at that point in time, and weren't awarded. We were not awarded through the second round, which is September 21st. We were not awarded through the third round, which is September 28th. And then in that fourth round, we put in the possibility of the TownePlace Suites on September 29th. Now, we didn't have a contract. We had no idea if we were going to be awarded or not. We were going to try something different here, much different than what the state was proposing as a homeless shelter. We didn't get awarded in the fourth round, which they told us at that point in time was really the end of the Homekey project, but then they came up with additional funding. We weren't awarded in the fifth round. You can see October 16th. And we were not awarded in the sixth round, which is the 23rd. So we were not awarded the 18 million for this project until October 29th, with a turnaround of the state asking us to close the deal by December 2nd. At that point in time, I don't believe we even had a contract in place, but we had to go to the board pretty quickly, which we ended up doing. The next slide, if we can. On the special meeting on the 5th, so that the board could take action on it. And then certainly, evolved to this point in time, today's meeting. But I just want to go forward here and talk about a couple other things that we'll be doing, and we can revisit this at the end. But it's just to give you a timeline, an idea of the timeline. So we hope to get the final certificate on December 1st at a special meeting. At the same time, we would release an RFQ for operators. So the property acquisition will be somewhere between that and the 8th actual ownership title transfer. The RFQ is responses are due by December 31st. The operator interviews and selection will start in late January. We'll have a meeting with RSCA and the operator in early February before we sign a contract with them, before we actually hire them. And then additional meetings will go forward as needed. We go to the next slide, please. So another question I had was, how will TownePlace Suites be used? Housing for low-income seniors, sheltering homeless persons, or other purposes? And this is that comment I heard about the flip-flop. We've been going back and forwards, and I just want to make this very clear. This is going to be a senior permanent housing, permanent affordable housing complex. So what does that mean? That's income cap of 30% of the area median income. And so that's extremely low. Additional priorities, seniors, typical of the county finance senior housing will be here. That's the formerly homeless seniors living independently in leased hotel rooms. So these are folks that, no fault of their own, became homeless in many instances. We are now housing them, but we need more stable housing for them. This will be the medically frail seniors. This will be disabled seniors. Seniors experiencing homelessness or at risk linked with wraparound services, and seniors who lost their home due to COVID-19. So these are the categories that will come into this facility. The senior and supportive services provided by the county and nonprofit partners, and to the whoever the operator is that we select will all be part of this. But I just want to reiterate this, that a lot of these seniors have simply outlived their savings in a very, very expensive area to live, as all of you recognize. This is a very, very expensive place to live, with a one-bedroom median rent going for, I believe, $2,700 now. So if we can go to the next slide, we can kind of see what we're talking about here when we talk about 30% AMI. And typically you would use 30% of your household income for rent. So that means for a two-person family, that would be 41,760 of their annual income. And they have the ability to therefore spend only $978 a month on rent. Think about the gap between that and a one-bedroom medium-priced residential unit here in this county. It's astronomical. And this is what's forcing many of our seniors who have lived in this county and worked in this county and raised families in this county to become homeless. And I can tell you story after story, but I'm sure you've heard them too, where folks have moved into their cars because they're just too proud to tell their kids that they're homeless or their family's unable to help them. So let's go to the next slide, please. Let's talk about some of the affordable senior housing in San Mateo County. We're very proud of this. We can go to the next slide. So this is in my hometown, Foster City, the Alma Point at Foster City Square. This is new. This is at the Foster City Square new development there. It's 66 apartments, extremely low and very low income seniors. These are homeless and medically frail senior preferences. These units are for them. And the developer and manager was Mid-Penn. I mean, we're so lucky to have some great partners in this county who do this kind of work and who watch out for these folks. And they run incredible operations. And this is one of them. If we can go to the next slide, please. This one is in South San Francisco by Rotary Terrace, South San Francisco. It's downtown South San Francisco, 81 apartments, extremely low and very low income seniors, preferences for homeless and medically frail seniors. The developer is Beacon Communities and the manager is Human Good. Go to the next one, please. This is Half Moon Bay Village. Half Moon Bay Village consists of 120 apartments, extremely low and very low income seniors, preferences for homeless and medically frail seniors, and the developer manager is Mid-Penn Housing. I think we got another photo of that too. This is some of the folks that we're talking about housing at these facilities. Okay, if we go to the next slide. So if we look around the county, we can see affordable housing complex financed since 2013 with Measure K funding mostly, and using those funds to leverage additional funds. We can see 43 affordable housing complexes financed by the County Affordable Housing Fund, 9 for seniors since 2013. And this would be a good time to just remind everybody, we have the fastest aging population in the state of California, right here in San Mateo County. And many, many seniors are going to be priced out of their residence. No fault of their own. Again, they're just going to outlive their savings, or rents are going to continue to rise, and they're on a fixed income and just cannot afford it. We go to the next slide, please. So what is the age requirements? This was another of the questions for me, and it is 62. The minimum age is 62. The other question, will the seniors be current San Mateo County residents? Certainly the county, we have a preference for all projects financed by the county to have county residents in it. Affordable housing applications always number in the hundreds and even the thousands, especially, a place like this that's very nice. So ostensibly, can I guarantee? And I guess the answer is no, because if only 80 people applied for the 95 units, and then we had folks from out of the county apply, they would get that. On a practical basis, we'll have hundreds, if not thousands, apply for these units. So, and for all practical purposes, it will be filled with San Mateo County residents. Next slide, please. So why are the 2 Project Homekey properties located in Redwood City, and how many others were seriously considered? So we reached out to about 140 owners of hotels in the county. We released an RFI for hotel owners countywide. We tried to send it out as widespread as we could. We worked with SAMCETA and the SMCSV Convention Bureau to advertise it. There was an expression of interest from about 10 throughout the county. And only one other serious option prior to Homekey, the Homekey deadline came in. However, I got to tell you that we're continuing to look at others, and these were two of the most viable ones that made sense on a per door cost and ability to be a turnkey operation. I mean, the TownePlace Suites are very attractive because you can immediately turn them to apartments, something that would normally take us for seniors. So because they do have they're all equipped with a kitchen. And they're set up like a small apartment, much like you would find in any affordable housing complex for seniors. Instead of waiting 5 years to find the land, buy the land, build plan for it, and then build it, we're able to do a turnkey operation here and put seniors in right away. Okay, next slide, please. Who will be the operator for the property, and what will the selection process be? So we've got, we're so lucky here in this county because we have some incredible operators of senior housing who really care, really know how to run these complexes and do a wonderful job with our seniors. And here we'll be looking for a strong, affordable senior housing ownership management track record. They've got to have a strong track record, demonstrated experience housing seniors with a range of needs, robust skill providing senior services. And just a little bit about the selection process. And I wish I could tell you who the operator is, but we're not there yet. The community assistance with the RFQ draft in the next 2 weeks. So I'm going to, once we're almost done with the RFQ, we will send that out to the association to review. And we want some input on that from the association, from the community, so we can get some feedback. Maybe we've missed something. Maybe there's things that we haven't thought of. We'll release it December 1st. The response is due by December 31st. And then we will select an operator. But before we sign a contract with that operator, we bring that operator back before the association to do a presentation where you can ask questions and really understand how they operate and who they are and what services they're going to bring. And then the selection will be in late January. And then I would suggest in the first year, we have quarterly meetings with the association to ensure that everything's running smoothly with of course, the vendor. And then thereafter, the association certainly would be part of our audit. But, our hope is, and this is true in with the other senior complexes that are run in this county so well, these facilities blend so well with the community that you don't even know they're present. So let me stop there because I know that there are other questions, but I just wanted to give you an overview and try to get those 6 questions answered up front. So Jim, I'll turn it back over to you.
Thanks, Mike. Nice job, because you're like right on time and you covered all of the 6 questions. There were a couple of questions that came in while you were doing this that I think are, you touched on, but one of them was like, how many did you look at? How many other hotels did you look at? What did you say? How many was that?
Well, we put it out to 140 hotels.
Okay.
And I think we had about 10 options. We are, again, Supervisor Horsley did a great job of identifying, some other hotels. We go before the Half Moon Bay City Council tomorrow to talk to them about a potential purchase of maybe a couple of hotels. And quite frankly, we're still looking for another hotel in the North County. So we do have shelters, as you know, in South San Francisco and in Redwood City and in East Palo Alto, and a variety of different housing options around the county.
Okay, good. And then just go back, if you can, I think, Jennifer, you driving the slide, just go back to the slide that says who this is for, because again, reading through this, I just want to make sure one more time you underscore who are going to be the residents here, because I think this confusion between homeless shelter and low income is really important to clarify. Or maybe you can just say that.
Yeah. So this again, and thanks, Jim, because I really do want to emphasize this. This is not a homeless shelter. This is for very extremely low income seniors. This is permanent housing. This is where these people will reside. They will be part of the community. They will hopefully, to the extent possible, be involved in the community, but some of them will be medically frail, and some of them may work. Some of them may be retired. The operator, we hope, and it will be part of the requirement, will be able to bring people to doctor's appointments through, van service. They'll be available for ready wheels. There's a bus line. Some of them will drive. Some of them will get vouchers for cabs through our human services agency. So there's a variety of services that will be provided, but this is permanent housing.
Okay, great. Well, let's use that then as a segue to the panel. I think I'm not going to introduce everybody in the interest of time. We're doing well here, but we've got a long list of questions. In addition to everybody that's listed up here, Mike had mentioned he has Ray Hodges with the Housing Agency and Ken Cole with Human Services as well. We can call on Jeffrey Morgan is somebody that you haven't met, who is with First Community Housing, and he offered to join us tonight to the extent that he can offer something from a experience of running one of these and developing these. So if there's some comments that he can add as we go through these questions, we'll be calling on him. So let's jump right into the first category, which is tenant selection and management. And basic question: what kind of screening, background reviews will prospective residents be subject to before they are permitted in and allowed to take occupancy?
Yeah, let me. I can certainly take a stab at this, but really for an in-depth understanding of it, why don't we ask Ray and Ken to give some input on this, since they have done this. And I just neglected to add that Ken Cole, before he came to the director of HSA, was in charge of housing. So he went over to housing, and Ray's been there a long time and doing a wonderful job. So let me bring those two on so they can answer that and really talk about the criteria.
Sure, thanks, Mike. This is Ray Hodges from the county's Department of Housing. So yeah, just to that question, I want to underscore again what Mike was saying, that this is permanent housing. This will be an apartment building, and just like any other apartment building, the people who live here will be tenants, and they'll have legally enforceable leases. So the operator who we end up choosing for the site needs to make sure that the tenants who are going to be living there can maintain their unit. They're not involved in criminal activity. They don't disturb their neighbors, but so they're going to screen for all of those sorts of things like any other apartment owner would do. But their main concern is that these folks can pay the rent. They comply with the terms of the leases. So that's basically what they're going to do. Wouldn't be much different than any other apartment building.
And Ray, one thing that there is one category that's excluded from this type of housing right off the bat, right? And why don't you address that?
Yeah, right. There was a question about sex offenders, and that actually is one thing that most financing sources for affordable housing just screen out right off the bat, and our operator would be doing the same thing here.
So those are precluded from. I mean, that's an immediate. You're not go beyond that. So.
Right, and I just want to say that these will be vulnerable seniors. So the vendor is going to want to make sure there's the right mix there, that they're safe, and that this is a safe place for these seniors to thrive also.
Okay, there was a question on the sidelines here. What does medically frail mean?
Yeah, I mean, I think they could certainly have any type of condition that seniors experience. And Ken and Ray, do you want to elaborate more on some of the ones that you've seen in a lot of these lower income housing?
Yeah,
sure. Go ahead, Ray. Go ahead.
I was going to say, so in a lot of cases, these are folks who have, due to an injury or an illness, that sort of thing, ended up in a hospital or in one of the county's health institutions. And upon being there, they were likely poor economically before going in. And when they recovered, they don't have any place to go. These folks, with ongoing services that they'd be linked with already from the county's health system, can live independently, but they just don't have a place to go. So we're providing housing for those folks in all of our senior buildings, actually.
And I think reading between the line, the question was, is that a euphemism for mentally challenged, or is it can be mental or physically frail?
Yeah, it could be either. In most cases, this is more about medical issues than
Physical.
mental health issues.
Yeah. Okay.
It could run the gamut from heart disease to dialysis patients to cancer. It could be just about anything.
So this is Ken Cole. I'd just like to join in quickly on this point. So I'm director of the Human Services Agency. And when you talk about, first of all, I want to emphasize this is permanent housing. It's not a shelter. And I'm a big fan of emergency shelter as a strategy, but there's a huge difference between an emergency shelter functioning in a community and permanent housing. And on the case of medical frailty, this is senior housing. So there's going to be, people will not be selected because they have a medical frailty, but the reality is working with senior population, just as in your own condo association throughout your community, you have people aging in place. So the operator that will be selecting for this housing will be addressing those medical issues, as they have to be ready to respond to those as those seniors age in place. Thank you.
Okay. So let's keep moving. Long list here. That was a lot of good stuff there. This is hopefully a pretty basic one. Will residents be required to get a COVID vaccine for free when it becomes available?
I don't think we can make anyone get a COVID vaccine. So to the extent, I mean, I think that it would be wise. We're going to encourage, not as a county, we're going to encourage people to get vaccinated, but we can't force anyone to get vaccinated.
Okay. What restrictions can be put in place to ensure the target population is not changed without consultation of the community and Redwood City? So if you're starting off saying it's seniors, it's this AMI category, these kind of qualifications, how is that codified, or how do you adapt that if you need to?
Well, I mean, we planned for the aging to be there a very, very long time. I can't even imagine it changing, because we're getting an aging population. This will be at some point in time one of the highest demands type of housing for folks living in this county. But I would imagine that if that ever did change, and I can't even imagine why it would, that we would have time to then discuss it with the community and the city and really kind of strategize on why there's maybe a different need at that point in time, and we'd be able to work together on that. But it wouldn't be something like this where it happened overnight. I mean, really, what precipitated this was just the funding that had to be spent in such a quick amount of time, and the late award that we got in the very last category. But any other type of change and any other type of situation, we want to go to the community. We want the community to be part of that process. This was just dictated by a state timeline.
Yeah, and we'll talk about it at the end when we talk a little bit about where we go from here. But I know, Mike, we had talked about some kind of annual review or process or something like that, where it seems like if you're contemplating those kind of changes, you could at least be talking about them earlier on.
Sure.
So, next one was, so some of the units are 2 and 3 bedrooms units. How are those planned to be used?
I only think there's 2 bedroom, and I think there's only 3 2 bedrooms and 1 bedrooms and then studios. I don't think there's any 3 bedrooms, but I may be wrong. I toured them. I didn't see any 3 bedrooms. They would be used, to the extent that we have seniors that are friends that would want to live together. I think that would probably be the way to maximize the space there and fit, potentially 3 more seniors in instead of 95. I could also see that if somebody was in need of medical care, like somebody through IHSS that needed a caregiver, that they could have one of the rooms while taking care of the senior. But typically, we'd like to maximize the use of these rooms for seniors, and that's what we'd be looking for.
Okay, great. All right, a couple of things here. We're going to move to the next section, but I just want to address a couple of things. First of all, for those of you that are writing in the Q&A, you can like a question, which will elevate it. The second thing is, there was a comment, can you answer these questions real time versus the pre-planned questions? No, the point of tonight was to answer the questions that the community had provided to us in advance. And to the extent that we can weave in some of these questions, we will try, but that was not the intention. So by liking some of the questions that are most important to the community, the people that are watching, we'll try to get those squeezed in. So let's jump over to the discussions around community and resident health and safety. So obviously, I think a lot of the either spoken or unspoken concerns, given the way a lot of people perceived this project was going to be, was its potential for increasing crime in the area or impacting the neighborhood. So can you talk a little bit about what measures or plans that you're thinking about in terms of crime, or what experience numbers do you see typically in these kind of facilities that relate to that drive crime, or how do they relate from a crime standpoint?
Yeah, I mean, I certainly recognize that when people, typically who haven't been around these type of situations, think of homeless, they immediately flash on those ones that I think we all have images of those with mental health illnesses or alcohol or drug addiction. And I think that is what really prompts a lot of the fears out there who are, out there committing crimes in order to feed that addiction. We just don't see that typically, and I'll let others address this. We just don't see that in the senior population. And again, a senior population that's screened because we don't want those people living in this facility. We will, an operator will be there 24 hours a day. They will have a firm understanding of their clients, residents living there. And certainly there'll be rules and regulations in place. And if they're violated, those individuals would be evicted, just like anyone else out of any type of apartment complex or condominium or whatever it may be. We just don't see those types of crimes, in the Foster City complex or the HIP housing one out in Half Moon Bay or the Rotary one in South San Francisco. You just don't see it. I mean, these are people that are seniors and living out their lives in hopefully a safe environment where they can thrive, just like any type of other senior living facility. But we'll also be open, Jim, to, like I said, in the first quarter, we want to meet, in the first year, we want to meet quarterly and then, annually thereafter, or really however long, whatever period of time the association cares to. It doesn't really matter to us. We want to be a good partner, and we want them to be partners with us and work in collaboration here. But to the extent there's other needs there that we don't see, we will address those, but there will be somebody on duty 24 hours a day, watching at the front desk and in this operation. We're happy to address anything that comes up.
Okay. Jeff, I'm going to call on you for a second. Do you have any experience or anything you want to share about either crime, relative crime rates in some of the facilities you've been involved in, or any things that you're doing particularly to try and manage that concern?
Hi, so I'm Jeff Morgan. I'm president of First Community Housing. We are an affordable housing provider. We actually run Villa Montgomery, which is over on the corner of El Camino and Vera. So thank you for having me on the panel. In our experience, we've been working with a property in San Jose, which was its first permanent supportive housing. So this is for a population of chronically homeless that are being given the opportunity to finally live. In chronically homeless, the definition is that they've been homeless for at least a year over a 3-year period. All of them had project-based vouchers. We have extensive cooperation with the county to provide mental health counseling and services and medical on site. And in that case, we're working with people that were the very top of the VI-SPDAT scale. That's a scale that basically measures vulnerability. It's a point, and the higher the points, the more vulnerability. So my case is a little more specialized. If you're just dealing with ELI housing and it's a little bit different, it may not be as intense. But for us, we had on-site security and roving patrol for 135 total units. We had a county, like I said, we don't have 24-hour care. There are caregivers that show up during the day and they reach out to the residents. they recommend at least a 1-to-20 ratio for services, and the county provided that outside of our budget. But within our budget, we also had our own service providers. So what we found is the incidences dropped dramatically the moment they were put in permanent supportive housing. We did have people with sobriety issues that got counseling. And, we also, for the first year, it was pretty rough. We had people that had to be stabilized, and it took some time where some people were able, about 90% of the folks stayed in place and they were able to continue in that community. And we issued lease violations to those that were not able to live independently. So, when we were working with a group that was chronically homeless, so I think it was a little bit more intense.
Yeah, but okay. All right, moving along here. Here's a good one, back to COVID. But so what kind of mitigation strategies are you thinking about if you have an outbreak in a property? And another common theme here is the proximity of this facility to the child care center next door, daycare center next door. How will you manage this if there's an outbreak there?
Yeah, Jim, it's a good question. And I just got to tell you, I'm so proud of our health department here in the county, because, as at the beginning of this pandemic, we had serious outbreaks in congregate living facilities for seniors. And quite frankly, that's where we saw most of our deaths. We went into those facilities, even though we're not obligated to, because it's really state run and regulated. But we went in and stabilized those facilities to the point where we hardly see any spread now. So we have expertise in that space, and our folks have done a fantastic job. We have folks going out regularly testing these facilities, is where we had congregate senior living facilities, and we're way ahead of the game. We have really stopped the spread of COVID-19 in these units. So to the extent that there was an outbreak, we would do the same, and we feel very, very comfortable in that realm, in handling that. Again, I just can't stress enough the work that health has done in this arena has saved countless lives, because they got in there, they trained staff, they took care of people, they put them in isolation when they needed to be, they contact traced, they do all the things that's necessary. And hopefully by the time we get in there, we will start to have vaccination in place. And certainly we can't mandate that people take it, but we would highly encourage it, given the science behind it.
Mike, remind me again from your timeline. So if everything went smoothly, when would you actually have your first residents there?
Well, that's a good question. Why don't I bring Ray back? Because Ray, I think you have a better handle on actually moving residents in. I see, the timeline talks about really when we would hire the vendor and so on.
Yeah, we'd be looking at late February, early March to start moving folks in. And the Homekey program actually has deadlines that you need to meet to start moving folks in. So we're going to be moving quickly, which is another reason this whole process is on such a compressed timeline.
Right. Okay. Here's another good one. Recreational marijuana, and I guess I would add to that medical marijuana. But so will recreational marijuana be allowed by residents in or on the property?
Well, first answer to that is no. But remember, there's not even smoking allowed inside this facility, or especially marijuana. That's not something that would be acceptable inside or outside the marijuana. To the extent that we would highly encourage seniors who are smoking not to smoke, because it's bad for your health, and certainly our health and wraparound services would work with them. But to the extent that that does occur with that senior population, we would probably have, like many places do, a designated smoking area outside for them to smoke at, but not cannabis.
And I know one of the conversations I had leading up to this is, how do you do that when you've got the daycare center nearby? Is there adequate outdoor space that you can keep those far enough apart?
Oh, yeah. Yeah. I mean, I've got I've toured the property one time and I see that, I mean, I think that we could certainly create enough separation between the daycare center, which is, you know, a ways away. There's a parking lot and there's then the daycare parking lot, and then there's a building, and it doesn't, I mean, then I think there's an outdoor play area there, but it's way on the other side of the building. So I think that we would, you know, certainly make that a priority, but we'd certainly not be encouraging smoking of any kind. But to the extent they're adults and they want to engage in smoking cigarettes, we provide a place for it to be done, and it would be a safe place.
So no smoking in the building of any kind, properly spaced, located, outdoor smoking for residents that need it, and then no recreational marijuana anywhere on the property?
No.
And that would be just a lease function of your lease terms?
Ray, yeah, I mean, I think that's right, Ray. I mean, that's, I mean, can you think of any reason that would occur?
No, exactly. And like you said, there's not going to be any smoking on the inside the property. Anything has to be outside. So yeah. And I think we would want to put that, you know, it's a big property. There's no reason we couldn't locate that away from the childcare center. But yeah, any sort of restrictions like that would have to be built into the lease.
Okay. So this may be a parking lot one, but I've got to ask it just because I think it's out of fairness of people who wrote it. So people are looking for assurances about this. What assurances do you have that the occupants will not pose a threat to the community?
You know, I mean, that's a good question. It's a fair question. I mean, one of the things that I would say is that I don't think you can ever be 100% sure that that there's no threat whatsoever in any situation, whether it's a condominium complex in Redwood Shores, a housing complex in Redwood Shores, a hotel like this used to be, with people coming and going all the time who we didn't have any idea who they were. But I think that here, especially, this would be one of the safest places because you've got an operator who's present 24 hours a day. You've got rules and regulations that are enforced. You've got wraparound services. You've got people on a lease that would be evicted. And quite frankly, these folks who do get in here, it's almost like hitting the lottery, right? You may have 1,000 people apply for this and 95 lucky people are going to get housed, when we know the demand is far greater than the rooms we have available. So they're not going to want to do anything in most cases to jeopardize that housing. But to the extent that there is criminal activity, you know, they'll be evicted. And if it was something that they could be prosecuted on, they'd be prosecuted on, just like anyone else.
Okay. Let's go to the third topic. Just I want to take a quick couple. We're doing really good on time. I think. Thank you everybody that's been doing the like thing. I mean, that's helped prioritize a couple of questions. So we'll try to get through those at the end here. So I want to jump over to the day-to-day operational piece. So first of all, who oversees the program? Who in the county is responsible for the logistical management of the Homekey project? And should issues come up?
Yeah, absolutely. Good. It's a really good question, and thank you for bringing that up. Let me first talk about who's going to be in charge of the property, and that will be the operator. So the maintenance of the property, the appearance of the property, picking up garbage around the property. That will be the operator's duty to make sure if the building needs to be painted, it'd be their responsibility. Now, remember, the operator will be collecting rents. One of the things that they're actually starting to work on right now is, like any building that's going to be operational with tenants, what is the expected wear and tear? What is the sinking fund? When will the elevators be serviced? All those things come into play now as we start to move closer to the closing. So we've got a team together that's going to be going in and looking at everything that needs to be done there. How much can they expect to spend on maintenance every year? Thank goodness there's no pool there or anything like that, which is, a money drain. But the rent should be adequate to cover expenses. And these are very, very skilled operators. They do this all the time. So, and of course, we'll be there. I mean, the county will be there in partnership with them through providing services, through Ken's shop to the extent necessary, wraparound services, whether it be medical or otherwise, food services, clothing, whatever they need, transportation, those type of things will be provided. But again, you know, we hope that the community gets involved, and we hope that the community wants to volunteer and help seniors and maybe drop off food or you know, it'd be like any type of senior living facility where there's going to be programs that'll be built in, you know, taking them to the theater or going out on outings or going to the movies, whatever it may be. You know, we want these seniors to sit in their room. We want them to be active. We want them to be out. We want them to be healthy. We want them to be enjoying life. And that's what these facilities really provide them, an opportunity to get their life back in a way that they can enjoy it and have housing security. And that is so critical to this community specifically, because they are vulnerable. You know, all seniors at some point do become more vulnerable as they age.
Okay. Is there any construction anticipated before conversion? I know one of the things that you said made this property attractive is it's pretty much a turnkey situation, but is there anything that has to be done to kind of get it transferred to this use?
You know, we went through it. I mean, certainly we didn't, you know, check every single room, but I got to tell you, the rooms that we did check looked like they were in great condition. I mean, the nice thing about this facility is the Marriott brand had to upgrade, I believe, every 7 years. And I think it was about 4 years ago was the last upgrade, and it really looks in great condition. And that, again, Jim, is why this property is so attractive. It is literally a turnkey operation. To the extent some things need to be fixed, you know, we'll have our public works group go out there and do a deep dive into it. But it really looked incredibly operational right from the get-go, from the laundry room service to all the kitchens and the facilities in the kitchens and the updated furniture in the units. And that's, you know, the other advantage is, you know, these units come fully furnished.
Oh yeah, right. Forgot about that. So, okay, I want to come back to the whole case because there's a number of questions in the sidebar here about capital costs, all that, but we'll come back to, let's just take some of these others that have been sent in. So we touched a little bit on this, but just to repeat, resident breaks the rules and regulations. So what are the repercussions to them?
They're evicted. I mean, it's just like any other apartment complex where rules and regulations are broken. The standard process is through the eviction.
Okay.
Process.
And then this may be more in Ray's court, but is the county going to provide case management for the tenants or case management service for the tenants, or is that, yeah, how does that work? Yeah,
we are, but let me have the expert talk about it. Let me have Ken come on and talk about
Ken,
that.
sorry.
Okay, thank you. And again, I just emphasize that affordable housing for seniors is not an issue of you know, I'm thinking back on the crime issue, as there's really no connection between affordable senior housing and increase in crime in any neighborhood. And really the seniors have even more of an invested interest in their safety, because seniors pretty much by definition are more vulnerable. So I just wanted to touch on that before I get into the services side. Again, a lot of the services hinges first with the operator that's selected to manage the affordable housing. And as Mike's already mentioned, we have a terrific a group of nonprofit or mostly nonprofit organizations that have a great track record in pulling together the services needed to support the seniors in this type of housing. In addition to what the operator will be vested in organizing, the county through Human Services Agency, through our health department, will be looking to provide additional services that are called forth by the provider based on what the needs of the individuals are. So we're going to keep a very close eye on the needs of this population in this housing. And as Mike mentioned, we're not looking to abandon people, move people in and abandon them. We want them to prosper and that'll require, in some cases, supportive services that can get quite elaborate, both on the health and mental health side. But we have this experience throughout the county of knitting together the services necessary to stabilize people in their housing. And the last thing I'd say too about the any kind of concern about rule violations. I mean, as Mike said, this would be like winning the lottery to get into a housing unit that you could afford. The residents, no matter what their background, are going to be highly motivated to hang on to this housing resource, which is going to be about following the rules and being a good neighbor.
Okay. Good. Here's another one, maybe Ken, along your lines. It's, will the facility provide health services, accessible, affordable, and healthy food? And how could this be achieved?
Well, first of all, I know our Director of Health, Louise Rogers, is in the meeting, may not be elevated to the panelist level, but I'll just say that our health department and this county is uniquely structured with a low-income health insurance program that is better than almost anything in the state. So we have resources available to support people in their health needs. I am absolutely confident in our ability to deliver that. And on the corollary of hunger and nutrition, of course, nutrition is essential to health. And again, starting with the housing operator, and it's very typical when we have the RFQ or RFP and select an operator, they will have a case management approach to interacting with the residents. And one of those critical issues is an assessment as to how is that senior, what's their budget? What are they able to purchase? Do they need to get signed up for a food assistance program that we can deliver meals or assist them in their nutritional needs? So it's just without a question that the food end of that paradigm will be addressed. And
Thank
again,
you, Ken.
as Mike mentioned, in the format of these units, they will have kitchens, which is a real advantage. And a lot of seniors, by the way, don't want a food service program. They want to still be able to cook healthy meals. Mm-hmm. And Louise, are you on?
I am. Hi, everyone. I'm Louise Rogers. I'm Chief of County Health. And Ken, you did a great job of describing what we can offer in health. I would just add a couple of things. Mm-hmm. We partner with the Health Plan of San Mateo, who is the insurance company for most of these folks who would have the opportunity to live there. And we're the provider, County Health is, and we have specialty services for older adults, including the Ron Robinson Senior Care Center over in San Mateo at our main campus. But we also, out of the Ron Robinson Senior Care Center, even send some of our practitioners into people's homes if they have mobility issues that make it difficult to travel to the clinic. And the health plan has a wide variety of really great benefits for their members. And of course, a lot of these members would also have Medicare as well. And the health plan even has a benefit for seniors to use Lyft to go to their medical appointments if they have difficulty with accessing transportation. So I would say that the health services that we can offer residents are really a great strength.
Okay, thanks, Louise. So again, we're tracking well on time. Let me just see. There's here's and you touched on this, I think, early on, Mike, in your introductory remarks. But is the county working with Samtrans to provide a convenient bus stop accessible to residents? What other low-cost transportation might be available to the residents?
Right. So, the nice thing is we do have a couple board members on the Samtrans board, and we're good friends with the CEO out there. So I think that, that would be an ask by us and the operator, and which is very typical of these senior housing complexes, that we ask Samtrans to try to accommodate these seniors as best as possible. And but these seniors will also be able to avail themselves of Ready Wheels. As Louise indicated, we have Lyft and Uber vouchers. We have cab vouchers. We will hope that the operator, and probably mandate that the operator have a transportation van to take folks on outings and to doctor's appointments and those type of things, to the extent that they can't get there by other means. But and then some seniors, of course, will drive. Maybe not many of them because of their economic status of where they are right now, and they may not have a car or be able to pay for insurance or those type of things. But some may, probably very few. So there's going to be a variety of ways for them to get around the community, to do the things that all seniors need to do: shop and go to doctor's appointments and pick up medication and go on outings and really enjoy life.
Okay, good. So last couple of questions I'm going to ask you, and maybe we can just do this quickly, but there's a number of questions in the sidebar and then some in here that are kind of related to the mechanics and the economics of the deal. And I think it would be good to walk through that because you shared some things with me. So first of all, the county buys this and they hang on to the facility, correct? It becomes a county asset?
That's correct.
And so what happens to the property taxes and whatever TOT or whatever else it was the hotel was paying prior to that transaction?
Yeah, I mean, those are extinguished because county or city entities don't pay property taxes or TOT. One of the things that we will have further discussions with, if the board directs me to, with Redwood City, is some type of temporary funding to overcome that shortfall that they may have expected over the next year or two. I can tell you that the property taxes are a lot less than the TOT, but typically what happens is that those rooms are absorbed in the market that are there. So you may see an uptick in other Redwood City hotels or motels because this one's not available. Those are the things, but we're gonna, we're open to having a discussion with Redwood City, and the city manager and I have discussed this briefly, and we're going to have more conversations about it. We understand that there's a limited amount of money for cities, but we also believe that this is such a community benefit that it is a necessity in this county that we have more residential, low-income housing, permanent housing projects like this throughout the county. So this is something that it's a trade-off, but we really believe that it is very, very worthwhile in this case.
Okay, and touch on the actual purchase price. I think when you and I talked about it, it's $310 a door, $310 a unit kind of thing.
It's just over 300 a unit, depending on how we outfit those. If we put two seniors in those double roomed units, it's $29.5 million. We received 18 million from 18 million and some change from the state for the purchase of this, and that's what certainly made this so attractive, that the state is giving us $18 million, and then we're using CARES funding to make up the rest of that. The state has also given us some operational expenses up front, and that's very attractive also. And they understand how important, and really, I'll tell you, the state's goal is to turn all of these places that they're funding for motels right now, and this one's much different because we're going right to permanent housing on this one. But for the other ones that they're funding for the homeless, their long-term goal is to not keep it for the homeless, but turn it into permanent housing, affordable housing for everyone to have a place to live. So that's and we're just so lucky here to be able to have a place that's really turnkey for seniors that will go right to affordable housing without going through the homeless process first. And quite frankly, that would have been a non-starter for us. We wouldn't have done it here if we didn't go to permanent housing for seniors.
And by comparison, Mike, to build a facility like this, if you subscribe that this is important to do and you went out to do this, what's the differential and what this costs versus what it would cost to build new?
This would be a 60 million plus building probably by the time you acquire the land and build it, and probably anywhere between a 4 and 5 year process. So somewhere around probably closer to the high 500s to 600,000 a door. And that's the other thing, Jim, that makes it so attractive and so economical for us to get this housing at this cost and make it turnkey.
And there was a question, and I can't remember if you told me this or it was when I spoke to Melissa earlier, but they said, why would a hotel even want to do this? You're in an area where there's, the last time they knew, they were hearing that you needed more hotels. So why did 10 hotels respond to this?
Well, I can tell you that COVID has changed everything. And, this was a hotel that primarily catered to the business travel. As I understand it, Monday through Thursday, they were very busy. But post-COVID, I think we're going to be in a very different world. I think that the virtual meetings will be the way of the future. We've heard of companies saying, look, we're putting our entire workforce off until through 2022. They've sold buildings, they've sold their rental spaces, they've vacated their rental spaces. We think that we're in a very, very different world now, that there's not going to be the demand that we saw for hotels. And I got to tell you, this is a beautiful place too. I mean, we're very, very lucky that this came on the market, and that it's really something that really fits senior housing that we absolutely need. So it's worked out very well, the timing of it. And that is probably in part why the state is funding this, because they realize that many people are getting out of this business now.
Yeah. Okay. So we got a few minutes. I want to hit these top two, which aren't easy, but we'll do them. So first of all, I mean, there's a common thread here. Obviously, a lot of unhappiness the way this went down. You've kind of covered this, but is this a done deal?
We hope it is. Yes. I mean, on December 1st, we're hoping the board takes action to accept the certificate of transfer and or authorizes me to accept it. And yes, I mean, yeah, we're moving full steam ahead. This is a great deal for our seniors who need housing in this community.
Okay, so we'll talk in the next section about if the transaction is a done deal. It sounds like there still are some areas where the community can play a role. So we'll roll that over to the kind of the closing remarks. But the other comment that was up here was why would you even consider a low-income housing project in a community that is far above median income? So. Yeah,
no, I can appreciate that question, but we need housing throughout the Bay Area, and you can see some of these other senior housing. The new one in Foster City is in a brand new development, mixed use development. The South San Francisco one, you can see that is in the middle of downtown South San Francisco. You can see the one out in Half Moon Bay, and all the other ones that we have around the county. We believe that these people who are occupying these senior facilities are San Mateo County residents. Some of them may have come from this community, and there, but the grace of God, go any of us, where you outlive your savings and find yourself in a position where you simply can't afford to live in a place where you maybe owned a home, maybe raised a family, have all your connections here. And I think that this is a perfect location for it. And these people, throughout their lives have added value to this county, and they deserve a safe place to live and a place where they can thrive in their senior years.
Okay. I just want to go back to, and then we'll go to the kind of closing thing. I want to go back to the mechanics as I'm just reading through the thread here. So as I understand it, the county buys this, they basically retain the asset, you hire an operator, and the operator is responsible for the ongoing cost. So their rent structure, grants, other things that they accumulate would basically pay for it just as if they owned the property and were a market rent place. Or is there an ongoing subsidy that the county will be required to provide?
Ray would be the best one to address this. I have an idea, but he'll be able to give you the specifics.
Sure, yeah, excuse me. So the lease would turn over all the responsibilities for the maintenance and upkeep and renovations to the operator, just like any of our affordable housing projects across the county. All of those, the operators, owners, developers of those properties, are constantly looking for different resources that are available to them to bring in at different times to help maintain and make upgrades and renovations in those properties. A lot of that money is money that the county has set aside over time too, and that's one of the uses of our affordable housing fund. We finance construction of new affordable housing, but we also, we're just as invested in this as anybody else, and we want to make sure that those buildings stay in good shape over time too. So we also invest, years later to make sure that those buildings stay in good repair.
And Jim, the nice thing about this for any operator is they don't have the typical debt service that you would see in a new construction. This is purchased outright. So those rents and any type of fundraising they can do as a nonprofit and any subsidies they get through the county housing would go directly into maintaining the building and making sure that there's enough programming for the seniors and it's run, and then it's very well run.
Right. Okay, well, I think I've gotten through a lot of this. I have to say I'm kind of blown away. We've got 172 people that are participating, and I don't even know how many questions or comments you've got because it maxed out at 99 and it doesn't tell us after that, but there's certainly a lot. But I think we got at least through the ones that got somewhere 30 plus likes and tried to weave together some of the other ones. So let's go to kind of the closing stuff, which is where do we go from here? Again, a lot of if the assumption is that the transaction is a done deal, it sounds like operator requirements, operator selection, how this operates in the future is something where the community still has an opportunity to weigh in or provide, their concerns and stuff like that. So maybe you can talk about, what the process is, Mike, and then also a lot of the questions about the operator solicitation, the RFP process and selection.
Yeah, Jim, thanks. And let me thank you and Sue again for hosting this in the city of Redwood City, who, we consider great partners in a variety of things that we do together. And we really are invested in all corners of this county and every community. And again, I want to apologize for the abruptness of this, for catching the community off guard, and for any of damage to trust that has been done to the county. I take full responsibility for that. Like I said, that buck stops with me. It's my job, and the board's hired me to make sure that we integrate the community into things that we do. And I tried to explain some of that, but to the extent that I failed, I can only ask your indulgence to try to allow me to build that trust back up as we work in collaboration on this just incredible project here. And to the extent that there will be involvement, I just want to reiterate that what we hope from the association is that we can get that RFP out to you probably within the next week, so that you can look at it and really evaluate it to see what we're missing, to see if we've overlooked anything. We don't think so. We've got experts working on this. We've done this a lot, but we want you to be part of that process, and we want to listen to your thoughts about that. And then when it comes to selection of the vendor, once we do narrow it down and select a vendor, or maybe we narrow it down to a couple, we'll bring that vendor or the couple of vendors before the association and allow you the opportunity to really understand how they're going to operate this facility, and to ask hard questions and to make suggestions and to build that rapport. And Jim, I neglected to answer one part of the question, and it was, who would we contact? And there's going to be a variety of ways for the public to get input if they have any immediate needs. I mean, they can immediately contact the vendor who's operating the hotel. We'll have that number. They'll have that direct number. They can contact Ray Hodges, who's the director of housing. They can contact Ken Cole, who's HSA. They can contact me, and they'll have my direct number. And again, the buck stops with me. And certainly their supervisor, Warren Slocum, can be contacted, and their elected official for Redwood Shores, who can certainly be contacted too, Jeff G. All of us work together in collaboration. We want to make sure that this is a successful project, in that these seniors are comfortable, that they're integrated into the community, that there's no problems, and that we pick the right vendor. So once we do get that vendor in place, I think it's important that we start right away with meetings. And I would suggest quarterly, that we have quarterly meetings with the vendor and the county and the city for that matter, but I certainly don't want to speak for the city, and the association, so we can get ahead of any issues that there may be, and that is an ongoing relationship. And I'll certainly put that out there in an MOU or through the city, whichever way the city manager decides that we should go on that. But we want this to be not the end of this meeting, an end of the relationship. We want this to be the start of a relationship with Redwood Shores, where we really work on this together. And my dream, my hope is that Redwood Shores residents embrace this and become part of this community of seniors, and help them. Many who may have struggled as of late, no fault of their own, but help them as they navigate their senior years in a beautiful community and I think the most incredible county in the state.
Okay. So you talked about process and the ongoing, because I think that those are the two main things. How is the community going to be involved in the selection? And so you talked about getting the RFP out for their review before it goes out to the operators, getting the kind of the finalists, if you will, in front of the community, and then setting up some kind of there's a question about a steering committee or some kind of oversight board from the community, or how that might work.
Yeah, the association is there. We're happy, and we know that they have association meetings. We could go to those, however they'd like to set it up. But there's a built-in mechanism now through that association, which seems like does a great job reaching out to people. There's almost 200 people here, so
yeah,
we'd be happy to work with Sue and the association, and to make sure that that the information is disseminated, broadly.
Okay. I'm going to move to just a couple of summary remarks myself, but are there any other panelists or anybody that would like to add anything that didn't get stated? Anybody from the city want to make a comment?
Hi, Jim.
Yes.
Hi, it's Diane Howard.
Hi, Diane.
I wanted to thank you and Sue. I wanted to thank Jeff G and the city. I wanted to thank the county, all of the players here coming together tonight. Sitting here, I feel very confident that we are going to move forward and be successful with this project. I really appreciate the openness of the county to sitting and answering the questions that they did. And I look forward to future meetings as we go forward. So thank you for allowing me to say my thanks for this well put together meeting. Thank you.
Great. Okay, so before we wrap up, and I'm going to ask Sue to maybe do the closing remarks here, but I just wanted to maybe, as the new guy who doesn't live in Redwood Shores, but is kind of new to this and somewhat objectively removed from it, I just wanted to maybe underscore a couple of things that I heard that I think are important for people to take home. And the first one is, as uncomfortable as it is, it sounds like the transaction is a done deal, so it's not worth debating that. But who gets selected to operate it and how it operates is still an opportunity for the community to weigh in through the community association, other things. So that's where, if you have concerns, and there's obviously a lot of concerns, that's where the energy should be focused on making sure it gets done right. To the mayor's credit there. I think a really important thing is this is permanent housing, not a shelter. And I think that those are two very different things. And the shelter obviously scares up a lot of images that scare people. And permanent housing is, like any other housing, it just happens to be at a different economic group. So please, it seems like that's important to know and make sure everybody is talking about the same thing. And it operates like any other rental housing. These are real people. There are leases and there are rules that everybody needs to participate and abide by. And if they don't abide by them, then they're removed from the property. And then the last thing is, not only is it permanent housing, but it's permanent housing for seniors. And I thought there were a number of really good comments made about, seniors want a lot of the same things that I hear in these comments. Are they want safety, they want security, they want their health protected. So they're not much different than you. And the fact that, as I think Mike and others said, they're lucky to be there because there's such a limited pool of quality housing and so many people on the list that they're unlikely to mess up their position to be there. So it seems like there's a lot of good components there that maybe have gotten lost in some of the frustration that I think are important to acknowledge and know that would make this, could make this really successful. So with that, I think we're just about right on time. And so Sue, would you like to close us out here?
Sure. Thanks, Jim, for being our moderator. I basically, in closing, RSCA wanted to thank our speakers for this evening and that we appreciate the various county and city officials we've been working with to make this meeting happen. I also want to thank the volunteers on the RSCA board who stepped up to get the information out to our community about tonight's meeting. There was a lot of work put in by a lot of people. And I just wanted to say, I am proud to note that 2020 marks the 50th year that RSCA has been working as the advocate for Redwood Shores. And we really encourage everyone in Redwood Shores to become a member of RSCA to help continue this tradition of service for our neighborhood. And one last note, a reminder that questions that we didn't have time to get to will be on our website. So give it a few days and just have a wonderful rest of the evening. Please look for more information on this development in the pilot and RSCA's website. And rest assured, we will be on this. Thanks.
Sue, one more thing. Tonight's recording, should somebody want to share it with people, will be located where?
On the RSCA. On rsca.org, that's our website. It will be on there.
Okay, great.
Probably, may take a couple of days, but it will be on there. Yes.
Okay, great. Well, thank you for letting me participate in this. Good luck with everything going forward. Hopefully it'll be a great success and a good example that we can look to around the state. Thanks.
Thank you so much, everybody.
Okay, I think we are leaving now.